My name is Bill Swan. I live in Halifax, Nova Scotia. I'm a lifelong severe asthmatic, and I have a little project called Faces of Pharmacare. The Canadian Emergency Relief Benefit is vital right now, but it obscures a worrisome concern. You see, people with chronic illness have expenses that other Canadians simply don't. We have drug co-payments. We often pay for medication directly out of pocket. And now with limitations in the amount of supply that we can have, we're going to see increased filling fees. I take 13 medications a day for my asthma, high blood pressure, and anxiety. So I think you can imagine that all of these little extra costs can start to add up. So, in the middle of this generation defining crisis, little has changed for the chronically ill in Canada. As a result, the very same problems we've seen in the past will persist. Diabetics will stretch their insulin, asthmatics will skip doses, a lot of high blood pressure will go untreated. And what about all these people that are suddenly unemployed? What if they lose access to their work-based drug plans? All of these completely avoidable circumstances increase the risk that people are going to end up in the hospital unnecessarily. And preventable hospitalization right now would be monumentally bad timing. When Canadians have full access to the drugs they need, they're more stable, they're more likely to stay out of the hospital. So this would be a really great time for the federal government to think about paying for these drugs directly and eliminate user fees, at least for the time being. Remember, the idea is to keep people out of the hospital when they don't need to be there for as long as possible. Look, there's very little that I can do during this crisis, but I can stay out of the hospital, and that means that the hospital is available when we need it most.